bloodstream infections is a systemic infectious disease caused by pathogenic microorganisms invading the blood. Severe cases can lead to multiple organ failure or even death. Morbidity and mortality have been increasing in recent years. When septic shock occurred, the mortality increased by 7.6% for every hour of delayed treatment, and the mortality reached 58% after 6 hours of delayed treatment. The total hospitalization expenses of patients with bloodstream infections in the world are as high as tens of billions of dollars each year. In addition, in order to prevent drug resistance, clinicians must initiate effective treatment as soon as possible and avoid overexposing patients to broad-spectrum antibiotics. Therefore, there is an urgent need for a rapid, accurate, and convenient technology to achieve precise diagnosis of patients with bloodstream infections, so as to solve the high morbidity, high mortality, high urgency, and high medical expenses of bloodstream infections. At present, blood culture is the gold standard for the diagnosis of bloodstream infections in clinical practice, which has made a great contribution to the rescue of patients with bloodstream infections. However, blood culture also has some shortcomings, such as low positive detection rate, long turnaround time, large amount of blood collection, usually only a single strain detected, easy to contaminate, inconvenient in drug resistance detection, unable to achieve dynamic monitoring of pathogens, and difficult in detection of multibacterial mixed infection, etc. Digital PCR is a highly sensitive nucleic acid absolute quantitative analysis technology developed after real-time quantitative PCR. The reaction system is evenly divided into a large number of independent microreaction units for PCR amplification, and the target copy number is calculated according to Poisson distribution formula to realize quantitative analysis. It has 4 core technology advantages of high sensitivity, high specificity, high tolerance, and absolute quantification. Pilot Gene focuses on the innovation of digital PCR technology and has launched a variety of digital PCR systems. At the same time, it is the first company in the world to launch an accurate diagnosis solution for bloodstream infections based on digital PCR technology. The solution requires no culture, takes only 2 to 5 millimeters of peripheral blood, and is easy to operate. It can perform absolute quantitative detection of 12 kinds of bacteria, 7 kinds of fungi, 5 kinds of viruses, and 7 drug resistance genes within 3 hours. Compared with blood culture, digital PCR has great advantages in turnaround time, positive rate, drug resistance gene detection, and dynamic monitoring. Pilot Gene is on a mission to lead the genetic technology and escort the human health. The company provides an important reference for the early diagnosis and rational drug use of patients with bloodstream infections, and improves the prognosis of patients to the greatest extent. The diagnostic solution will greatly reduce the mortality and treatment costs of bloodstream infections and facilitate the integration of precise diagnosis and treatment.